Hey guys, we are live on Facebook. This is a Local 100 Fight Back Coalition event. Um, we're so honored today to be joined by Chris Smalls. For those of you who may not have been under a rock and not known how Chris Smalls shook up the world, Chris was the hero of workers' walkout over things related to the coronavirus. And, we're really honored to have him be with us and share his time with us because Chris's phone's been ringing off the hook. He's been involved in a lot of actions. And we're so honored that he's here to share his experiences with transit workers. So, Chris, the floor is yours. We want to learn from your experiences. And, we think there are a lot of lessons for transit workers and other workers in your experiences. So if you could start off with like telling us about what it's like to work for the behemoth, vicious employer that Amazon is. Like, what are the conditions like in the factory, even before Corona?
Absolutely. First and foremost, thanks for having me. Appreciate the time. Um, yeah, and for those who don't know, I've been with the company since 2015. I started off as a regular warehouse associate. I started off making 12.75. I had to work hard to get promoted for about 7 months, and I was able to get promoted up to a process assistant. That was the last position I had before they terminated me on March 30th. Working there for Amazon, usually I would tell everybody just some of my personal advice to survive working there because it's a high turnover company. We all know that. They hire and fire all the time. They're hiring now. I would tell people, the employees that I had underneath me, if you have a gym membership, you might want to cancel it. It's 10 hours of calisthenics. There's no way to sugarcoat that. I always try to be upfront with every new hire that I seen come in that door because you can't work there and continue to work to do the same thing that you normally do. You have to prepare yourself mentally and physically, especially physically. You have to make sure you're eating healthy food. You have to make sure you're drinking plenty of water, stay hydrated. That's what separates Amazon from its competitors is the fact that we work longer hours and we work at a high rate and a higher pace. Um, a normal day, you're up and down the ladder, you're bending, you're squatting, you're reaching, um, and we hire people from all age ranges from 18 to 80 years old. I've seen them come. So it's hard to train somebody who's a senior citizen to work like a 20-year-old. But this company has a way of doing that, or at least attempting to doing that. And they also burn out their younger adults. Myself was a part of that as well. After doing a certain job for a number of months, it definitely takes a toll on your body. So just so you get an idea of working there, that's what you have to make sure you keep in mind.
Yeah.
Um,
Chris,
that was
how big is the? I'm
mhm.
sorry. How big is the facility we're talking about here?
Staten Island alone, 900,000 square feet, about 14 NFL football fields. So you can imagine how much mileage you're putting on your legs. Me, for example, over the past 5 years, I probably walked the United States a few times.
I'm sure you did. I understand also they have a lot of surveillance there, right? In terms of like monitoring when you go to the bathroom and all that kind of stuff, like just being on top of the employees. Is that what been your experience?
Yeah, they have uh, quite a couple thousand of security cameras. Um, for a good reason, though. People do actually, unfortunately, people do work there, and they do steal certain items that they sell. So most of the time, the camera footage is for that. Also, it's also to monitor any type of workplace violence. So it's sort of pros and cons to it. But yes, it's quite a few thousand security cameras in these buildings.
Wow. How did you first find out about the potential risk of COVID-19 in your facility?
Well, I didn't find out. I had to do my own. due diligence and my own sense of urgency is the way I found out. We had some managers in late February, beginning of March. They were out in Seattle, which was the epicenter at the time for training. They came back to our building in Staten Island, and one of them left the shift early because she wasn't feeling well. I'm not trying to say she was patient zero, but at this time during this pandemic, I definitely had a high alert and a sense of urgency. I took a mental note of that. Soon after that, I started to notice my employees become ill, my colleagues become ill. They were calling out of work with flu-like symptoms. Some of them were dizzy, they were fatigued, they were vomiting at their station, their workstation, and we would clean up the vomit and put somebody else on that station, which was just didn't sit right with me, you know. So I started to escalate my concerns the beginning of March to the HR department and the higher ups.
Now, you said the worker that you had known was some symptoms. She had like bloodshot eyes and all that, and
Absolutely.
you sent her home, right?
Yeah. So I took some days off in beginning of March to protect myself and my own family. Obviously, I couldn't take off the whole entire month unpaid. I had to take money out of my 401k. Had to do what I had to do to get by, just so I can survive. But then I had to go back to work to get a check, at least to pay my April's rent. So I went back to work on March 24th at 9 o'clock in the morning. That's when I encountered my colleague. She's a supervisor as well, like me, same department. And yes, she had bloodshot eyes. Her face was real red and rosy. She was fatigued. And she told me she was sick. And she told me she went tested for the COVID-19 the night before, which was Monday, the 23rd. So I advised her that she really should go home. And she definitely did. You know, we're friends. So she went home. That was about 9 o'clock that morning. 2 hours later, we have our daily sync meeting amongst the managers that we have every day. And that's when we learned about the first confirmed positive case that was in the building on March 11th. The associate wasn't there that day. He hasn't been there for a number of days, but his results came back in on March 24th. As you all know, or may not know, the Queens, New York facility, they had one confirmed case. They closed down and sent everybody home with pay. They sanitized the building. Everybody came back the next day. I was expecting the same thing with Staten Island. I asked my management, like, hey, are we going to tell everybody? They basically told me no. We don't want to tell our employees because we don't want to cause a panic. Business as usual. We're going to go to individuals that worked on that side of the building where the associate that tested positive last was working. Didn't make any sense to me. I said, it doesn't matter how long ago he was in the building, he was here. You know, it doesn't matter to me. And that was my last time working for Amazon. I left the building at 12 o'clock that day, not to return as a supervisor.
Yeah, I also see that Amazon is trying to put out this narrative that, you know, you were endangering your coworkers, which, you know, from I've seen your previous interviews about this. I mean, it couldn't be further from the truth. And I want you to talk about, you know, like their concern for these employees. Here it was, this worker who you sent home, she was working 10-hour shifts every
Absolutely.
day, and she could have been affecting many, many other workers. So if you could talk about that.
Sure. Yeah. She was. She was already affecting hundreds of employees for a number of days in a row for 10-hour shifts, like you said, prior to me coming back to work. And the funny thing about it, Tuesday is not even my regular shift to work. We're actually on mandatory overtime. So we're working 5 days. Tuesday is my overtime day. So had I not came in that day, she would have been there a whole nother day as well. And the next day, which would be Wednesday. But fortunately, I did come there that day and sent her home because she did test positive. And when I received that text the next day, I ran because let me just back up a little bit. What I did from that day forward, after I left on the 24th, I came back to the building Um, every single day off the clock on my free will, I sat in the cafeteria for 8 hours a day, starting at 7 o'clock in the morning to about 4 or 5 in the afternoon. I sat there and I told as many employees the truth that management didn't tell them, that they've been possibly exposed to somebody who tested positive, and we need to voice our concerns. So by me doing that, in the midst of me doing that, that's when I received a text from the colleague I sent home that her results came back positive. When I received that text, I ran to the office. I ran to HR and I told them, like, hey, look, not only have I been exposed, but my whole department's been exposed. You definitely need to close down the building now and quarantine it. That didn't happen. They basically, it was like, we'll notify you over the phone. And I'm like, well, I'm telling you verbally and physically that I know you don't even have to do all of your investigation, because the way they do it is they have somebody that rewinds the camera. We don't know who this person is. And this person is supposed to quarantine people based on who the person came into contact with. But unfortunately, they're not doing a good job at that, because they only quarantine me and only me. They didn't quarantine none of the employees in my department. They didn't quarantine the person I ride to work with every single day. So that tells you right there that they wanted to silence me. They had a target on my back, and to cut off the head of the snake. They put me on quarantine on Saturday after me coming in and out the building the entire week. They knew exactly what I was doing. They even helped me orchestrate it. As I came into the building every morning, and I took a group of 10 people into the general manager's office with the head of HR, and I had all 10 people voicing their concerns. And we did that every single day at 9 o'clock in the morning. We interrupted all his meetings to make him get on the phone to shut the building down, which never happened.
So now, Chris, you also faced, like, even after they fired you, even after you lost your job, but for standing up for basic human rights, for your coworkers, even after they tried to make an example of you in that way, they have now taken to, in a leaked memo, it's been exposed that they actually were engaged in a racist campaign of character assassination against you. And just to read from their memo, the memo said that they wanted to make it a battle pretty much between you and them, because they felt that you were, quote, not smart or articulate. Well, anybody who's been watching the live stream just here knows that's ridiculous. But if you could just talk about that, because you were saying before in previous interviews that your response was thank you, that Amazon and Jeff Bezos have been shown who they are.
Yep, absolutely. My responses to that is that these people never did anything for me. I don't know them personally. They don't know me personally. So it's a shame on Bezos for having people like that around him. Number one. Number two, it also exposes the fact that they really don't care about their employees. For them to ignore the safety concerns and the work conditions of these warehouses, completely ignore them, and worry about somebody that's at the bottom of their company, making $25 an hour. That's just a shame on them, and that tells everybody who these people are and what they really are about. And that's why I say thank you to whoever leaked it, because I don't think it was done by accident. I still don't. But at the same time, yeah, it's never going to be Amazon versus Chris Smalls. It's going to be Amazon versus the people. I'm not going to fall for the trap.
Right. You were talking about the way they treat the employees. Like for example, can you talk about like the PPE that's provided to employees? Like they want to make it seem like they're doing due diligence about safety, and they're going into damage control after you shined a light on what was going on there. But what exactly is their response to safety on the job?
Well, yeah, they didn't start it until after they terminated me. So that's what it took for me for them to provide PPE is ridiculous. The simple fact that we went unprotected for a few months prior to them providing it in April, after they terminated me, after I shed light to what was really going on. They're playing catch up, and it's a little bit too late for that. The PPE, we didn't have any facial masks. We didn't have any cleaning supplies. The cleaning supplies were very scarce that we did have. The cleaning crews that they hire, the third-party company, they're humans as well. They don't show up to work all the time. Especially if they're hearing that there's cases in the building, why would they put themselves at risk as well? They don't get paid as good as the employees there. So we got to take that all into consideration. And yeah, it's just a scary situation to go to work now. This is why they are still on the hiring spree, because they're actually trying to meet the demands of the company, not the demands of the customer. You know, I know people that don't go to work and rather stay unpaid and be safe than to put themselves at risk.
And Chris, you were saying that the money that you're raising through your GoFundMe page, that you didn't want it for yourself, it wasn't money for yourself. That's who you were trying to raise money for. You were trying to raise money for people who couldn't work, or people who are struggling who are still working.
Absolutely. Absolutely. Yeah. The money that I'm raising with the GoFundMe is actually for my former colleagues that are unheard of. These are the voices that I'm speaking up for, the ones that basically have underlying health conditions, the ones that are home, as far as young adults that have parents that's telling them don't go to work because we don't want you to get sick, the senior citizens that have weak immune systems. These are all people, these are all friends of mine. You know, this is my extended family. I spend 40, 50, 60 hours a week with these people for years. So I really care about them, and I'm going to help them out. Some of them were actually the ones that were holding the signs that was in my protest. These are the people that are unpaid, and these are the people that stood by me side by side in the fight. So I owe it to them.
Well, speaking of owing something to someone, I think, transit workers who watch this live stream, we need to know that we need to devote whatever resources we can to help Chris in his fight. It shouldn't be a one-man battle against Amazon. It should be, as Chris says, Amazon against all of us, against the people. And we want to hopefully get as many donations so that you can actually get some of the support, because we know that it's a situation to be without a job in this economy. We know you have, family members that depend on you, so, those who are watching, it's time for us to step up and to support his fight. But also, I want to try to open it up for other speakers. We're also going to people writing comments if they want to ask questions. So
absolutely.
Okay. Jay Holland is going to be speaking. Jay is a train operator in New York City Transit. Jay, you got the floor.
All right. So, everyone can hear me, I assume, right?
Yeah.
Yes, sir.
All right. And Chris, I want to thank you for everything. I mean, I've seen multiple interviews. I was even aware. I watched the one that I believe you did with The Rising, right?
Yes, sir.
With Crystal Ball and I always forget how to say the other guy's name.
I know who you're talking about. I'm the same way.
Right? Yeah.
Yes.
So I really did appreciate that interview, because I really like both of their perspectives, even though they're slightly on like different sides politically. They really do seem both to be like advocates for the cause of workers, right? So I really, if you haven't touched on that so far, I would just like to maybe get your perspective on that interview, and maybe add to it if anything wasn't said during that time.
Yeah, actually, it's funny you brought it up, because my mother watched a interview, not an interview, but a clip of their segment, and she sent it to me. But this was before I even interviewed with them, and they were very adamant and very vocal about the situation, about how they fired me and how they tried to smear me. And I was like, wow, I was impressed. Like, I really would love to talk to them. And then days later, I get an email saying, hey, would you like to be on the show? And so everything happened for a reason. And I'm very appreciative of their standpoints. And we actually still communicate on Twitter, especially Crystal. Crystal and I, a lot of people are including us in tweets together, because she really has been vocal and an advocate for standing up for me. And I'm so appreciative. Not only them, with everybody I interview with. Usually they may not say it on air, But they usually do behind the scenes or in the green room. They'll tell me like, "Oh my, I just want to say thank you," because it's a very tough situation sometimes to put them in politically, but at the same time they know that I'm doing the right thing and not continue to do the right thing.
Right. It just seems like to me a company like Amazon that has all these resources, all this money, like even just from it almost seems to me, and I might just be rambling for a moment, but I think this is a fair point that these companies, it almost seems like they care not as much or much less about like just from like a political standpoint. This is not good. This is not, what's the word I'm looking for? And anyone, if John can fill it, or you can fill it in. This is not good. Like, well, basically, it just doesn't make them look good.
No, yeah, it's bad publicity.
There you go, publicity. It's just simply bad publicity. How do they not know that? I mean, it's kind of, I know I'm asking you a question. I'm speaking at the same time, but it's like the same thing with transit from my perspective. For them to not have simple resources from the beginning and to even put out a bulletin stating that we were supposedly going to be in trouble for wearing a mask. I mean, that's definitely something that's not going to look good. And it just seems like these companies like Amazon, it's not good publicity. How do they not see that now? It's almost like, I don't know. I am kind of rambling, but maybe you can.
No, you make sense. And what I say to that is, this is a time for frontliners of all types, transit included. This is a time that we have to take the power back. This coronavirus exposed a lot of these CEOs that are not taking care of their workers.
Right.
Unfortunately, just how our chief and commander was late in the game to protecting the country, so was these companies.
Yeah.
And it's our job as workers to speak up, because we all know we are the power. If we continue to go to work and we don't say anything, they're not going to do anything. So basically, it's our time to come together in solidarity and just work together to make sure that the public knows what's really going on. So once the public view is in our favor, they have no choice. Right. we have to put them in the corner, and we have to shed light onto what's really going on. And transit is definitely considered frontliners. You guys are essential too. And what's going on with you guys hasn't been really known out there to the public. So we have to come together and we have to make sure that the world knows what's going on with you guys as well. You guys deserve to be protected and deserve to be paid if y'all staying home. If y'all decide to stay home, they shouldn't force y'all to go to work. We understand that everybody needs to get somewhere, but at the same time, you guys are people too. You got families, just like the same thing with Amazon. We got families at home. Right. So, it's the time is now. This is the window of opportunity that we have. The virus exposed that, and we all just got to stand up together.
Yeah, Chris, I just wanted to let you know that on the call, we also have another frontline worker, Sarah Dowd, who's a nurse at Harlem Hospital. Welcome, Sarah. Let me unmute her. Hold on a second. Sorry about that. Why isn't it? Okay, there we go. Hello, Sarah.
Hi, how are you?
Hey, how you doing?
In introducing Sarah, I just wanted to try to make the connections between your experience and hers and ours. Jay was asking the question like, well, why don't they care and what don't they see this as bad publicity? And I think really some of the answer is the moral depravity of the people who run a lot of these companies and who run the world. Like that's part of the problem, is that it's not even an afterthought to them. Our lives just don't matter to them. They don't even see us as human. So Sarah, if you could talk about your experiences, and welcome, by the way.
Thanks. Yeah, I think it sounds like it's been said already. Like they will only do absolutely what they have to for us. And we are responsible for fighting for what we actually need. And And, you know, a lot of us have had to resort to shaming our employers, but if that's what it takes, then that's what we have to do, because this is about survival. You know, at Harlem, we had a rally out front, and, you know, I know the administration was embarrassed, and
Good for them.
yeah,
Yeah. Hey, you gotta do what you gotta do.
tough shit. Like, you know, we have people work, you know, luckily we haven't lost anyone at Harlem yet, but that's like the absolute worst case scenario. We've seen a lot of other public sector nurses and some private sector nurses dying. And, you know, even more transit workers. And so this is not a time for frontline workers to be kind of going through the appropriate channels. Like, we have to kind of take this into our own hands and fight for what we need. And I've been inspired by all of you guys, Chris, you know, and the amount of work that John has been doing. John was at our rally at Jacoby yesterday, 2 days ago. The days are running together. And yeah.
So Sarah, quick question to you. I heard you interviewed on Democracy Now, and like one of the things that was really shocking to me is the idea that they would ask you to wear an N95 mask for 12 hours, for 12-hour shift. And also like that a nurse, I know a nurse died, I believe was that at Mount Sinai where the nurse died? She was wearing a garbage bag because she couldn't get full body covering. So if you could talk about some of those conditions.
Yeah, it's been really horrendous. The initial policy was for us to use the same N95 mask for 5 12-hour shifts, which is about 60 hours of work. If you've ever worn an N95, you know that there's the elastic component is very important in creating a seal. And so that wears out over time. And so the masks become less effective. After our action at Harlem Hospital, Cuomo did issue an edict that all healthcare workers throughout the state would receive a new N95 every shift. But again, like we've had to fight for that, even since it's been declared as what should be. But that's fine. We'll fight. It's okay. You know, and as far as the rest of the PPE, you know, we've had varying types of surgical gowns and isolation gowns that they've given us of different levels of protection. And the administration is consistently telling us that, you know, this is just as effective as this, when there's no scientific basis for that. And a lot of the changes in the requirements for what we need to work have not been based on science. And that's one of the most infuriating things, when we're being told that our profession is based on, you know, evidence, and seeing absolutely none of that out of our administration or the federal government.
Sarah, speaking of the federal government, sorry to interrupt. Speaking of the federal government, the CDC specifically and the American Hospitals Association were working like kind of on a full court press to cut mandated PPE for you guys. Could you talk a bit about that and Trump's role behind that?
Yeah, I mean, I feel like it just kind of gets back to the same point, which is that they will only do exactly what they have to. And you know, I know that the Hospital Association had made a concerted effort to roll back guidelines in order to avoid potential litigation. You know, they're basically trying to cover their ass for the situation that they've created, which is not surprising at all. And, you know, the CDC is kind of an ineffectual organization to begin with, you know, and their guidelines just further prove that. But, you know, as nurses, we know that this is what they're trying to, I'm sorry for cussing so much, I don't mean to, but they are basically trying to feed us bullshit. Like, we know, we have seen the research that this is an airborne virus. If you come to my unit and try to tell me that a surgical mask is adequate, I know that you're lying to me. And it's just, it's insulting.
Yeah.
And, you know, Trump, my expectations for him were very low to begin with. So I can't really like come down too hard on him, because I expected nothing.
Well, I mean, and as you should not have much expectations of Trump, but you know, like the problem is that our bosses are actually following his lead. You know, like in the case of transit workers, they specifically cited the CDC regs made by Robert Rensfield, who's nothing but a Trumpster moron who will do whatever Trump wants. Like, you ever see him at these interviews where they're together? He like stares into Trump's eyes. It's crazy. We're paying the consequences for all of that. Also, one other thing I wanted to highlight is that, you know, a lot of the hospitals, especially the public hospitals, are attacking nurses' ability to take sick time right now. If you could talk about that a little.
Right. So just in the last week, we've had a new sick policy come out that we found out via email on Friday night at 10 p.m. That we are no longer able to take a sick day without a doctor's note. So the previous practice was if you had 3 days, sick days in a row, you would need a doctor's note to come back to work. And they've rolled that back and said if you even have 1 sick day and you don't provide a doctor's note, you'll be docked pay. So I've had coworkers, even a coworker who was on FMLA, have pay withheld. And it's ridiculous because it's like they're kicking us when we're down. They've created conditions that will make us sick. And then if we try to take sick time, we get reprimanded. We basically get punished and have our pay withheld. And, you know, people are trying to make it work, but the reality is that when you're sick, you have to then go and try to make an appointment, see if your physician even does telehealth, get a note, figure out how to get it to HR. And you should be spending that time getting better instead of trying to figure out how to get a little piece of paper from point A to point B.
Absolutely. I want to ask if others have questions for either Chris or Sarah at this point. If you could raise your hand on the Zoom account so that we can open up your mics. Anthony, would someone like to speak? Anthony, is that a hand? Steinig, are you trying to speak? Anthony.
I had a question for Sarah.
Okay, go ahead.
Yeah, hey Sarah, Seth. I wanted to go back to the CDC stuff, and you know, because in transit, one of the things once transit workers started dying in significant numbers, and it was exposed that we didn't have PPE or basic sanitary conditions or sanitized conditions, that our chairman, Patrick Foy, tried to hide behind the CDC regulations with respect to saying, oh, well, we had some masks, but we didn't issue them because the CDC said workers shouldn't have masks. And that sort of goes so I was wondering if you might be able to say something to connect up your experiences with those changing regulations that leave workers exposed in healthcare and transit, you know, like with respect to how those connect up, because you're a nurse, as you said, you know, a lot of us transit workers don't know as well. You know, we were clamoring for masks and asking for them, and yet for some reason we knew better than our bosses. But if you could say a little bit about maybe trying to make a connection there with respect to those changing regulations and them trying to hide behind them.
Yeah, I think this might sound weird, but I almost think the guidelines are irrelevant at this point, because they're written by people that have an interest other than the interest of workers. And so I think our role as people who are trying to advocate for what we need right now is to figure out what it is that our coworkers want and what's going to keep our coworkers safe, and then just fight for that, because we're in a time where frontline workers basically have the microphone. And if we can apply enough pressure saying this is what we want, this is what we feel safe with, then it almost doesn't even matter what the guidelines are. Not to say, like, you know, the science behind it isn't important. Like we have obviously used that to make our argument for new N95s, but the guidelines they're not written by us. They're not written for us. they're written for the hospital associations, they're written for the bosses. Like we know what we need, and we need to just organize and escalate around demanding that.
I agree. Yeah, just to piggyback of what she's saying, she's 100% right. These CDC guidelines that they even provided for warehouses they don't work. It's so funny that you brought that up, because the last day before they quarantined me, my general manager printed out the CDC guidelines for me to read and slapped it on the desk, and it's like a big old packet. And I'm like, I don't even need to read this. It's not working. Whatever guidelines is in there, whatever it says in black and white, it doesn't matter to me. This is not the reality of the situation. What Sarah is saying basically is these people that make these guidelines are just like the spokespeople that speak up on behalf of these companies. They don't know the reality. They're not in the trenches with us. We're in the trenches. We know what's going on. We know what our employees and coworkers need. They don't. They make up guidelines just to say, oh, the company's in compliance. Amazon tried to do that with me. They gave me the guidelines. I did not read them, but I did read one section. And one section that stuck out to me was, if somebody tests positive, you have to reduce your workforce by 75%. Wow. So I'm like, yeah, okay, that's good to know. But at the same time, we're not doing that. So, but it's so funny that they showed me that day, because that very day they started sending people home voluntarily. So I was like, wait a second. I said, oh, let me get this straight. We're so essential. We're in high demand right now. You need all the employees you can get, but you're sending people home. It's because they caught wind of somebody calling the health department or the CDC on them, and they were expecting them to show up unexpectedly and do an investigation. So what they were doing was reducing their workforce by sending people home voluntarily. And I caught wind of that. So they tried to counteract my protest by sending people home throughout the whole entire weekend. But they forgot that I was still actually internal. I still had the conversations between the higher up. So I was literally reading their plan as they were trying to do it. And I still was able to pull off my walkout successfully because of that.
Yes.
But yes, just to say, the guidelines don't work. We got to make our own guidelines.
Oops. Yeah, I think they were reading their own press clippings about you not being smart or articulate, right, Chris?
Absolutely.
I see Jay had his hand up. Let me unmute him.
Yeah, actually, it was a point that was made earlier that I'm very happy that I remembered, because I forgot it for a moment. I think it happens to all of us. But I received a text message, and I don't know if it's from, I apologize for not having the exact clarity in where it's from, but it states as a quote. So it's a message from the MTA Chief Safety Officer, right? So follow me in this. And it states, right, now, I read this just as a statement, but then skepticism came in after completing it. So it states, New York State Executive Order requires all customers and employees to wear face coverings when within public transportation. So far, so good, right? Now, here's a good part. And in situations where they cannot maintain social distancing requirement of 6 feet from others, beginning tonight, which would have been last night. So I'm like, well, hold up. So we were mandated by the governor in New York State to maintain social distancing of 6 feet, the same way you see them doing in grocery stores, where they're limiting a certain amount of people to be able to enter the stores at one time now, right? But if you see, and this is, I'm pretty sure this is not exclusive to transit, but if you've ever seen most of these crew rooms, right? I made this point last week. Most of us have living rooms bigger than these crew rooms. So that I don't care what you do, unless really there's not really any good option. We don't have the ability in most of these, if not all of these crew rooms, to maintain proper social distancing. So if you were able to read into that quote that I just read aloud, they basically put this caveat in there to say, if you're not able to do the thing that we just told you you should be doing, then you must do this. So now that gives transit an out, because now if you have a crew room, like some of these crew rooms are like almost janitor closet size, right? Yeah. So now if you have transit has this really tiny crew room, now they no longer have to be worried about having you follow the social distancing and then have certain rules applied to them. They can then just say, well, if you're not able to do social distancing, you're supposed to have a mask on. And now it kind of allows them to not to be worry free. And I don't know if anybody else read it that way, but I totally see that in that message. Like they've added a caveat to their own rule, right? I mean, if anyone wants to add to that, but I just feel like how is it all of a sudden they can create a rule? Now, I don't mean transit, I'm talking about New York State. How do you create a rule and then you throw this caveat into it? I don't understand that.
Okay, I'm gonna have Seth lead the discussion for a little bit. So Seth, if you can unmute yourself.
Yeah, I got it. I just let me follow up on what Jay was saying first. Those of us in transit and all the transit workers watching this either live or later, we all know that, and I appreciate Sarah and Chris coming in on the CDC stuff. We all know that they were using that to try and, cover themselves. And the fact is that the masks were only one small part. There were a number of other safety measures they weren't taking, including in sanitizing our operating positions. 10 or 15 of us might use the same operating position every day. And we just asked that if every time someone gets done with it, that either we're given stuff to sanitize it or they, have a cleaner sanitize it, but they refused, and also the social distancing. We have small crew rooms. I'm documented on March 17th talking to my superintendent saying that the crew rooms were too small, they weren't enforcing social distancing, and that everyone was going to get sick because of it. And what's disturbing even now, Jay, I can tell you is that, and I plan to try and do something about this, they're not taking social distancing seriously with respect to crews. There are work locations that I know about right now where they actually have extra rooms that they use for like classrooms in the same complex that they could open up and say, hey, we know that these spaces are small. We know that there's reports of crowding. We're going to open up every space in this complex. Some places don't even have that. But even in the places where they do have that, they're not opening up auxiliary facilities. And so what they're saying is that on paper, we're taking social distancing seriously, right? We say that, but in reality, that we aren't even going to take the most basic steps. We're not even going to turn a key and open up an extra room.
Right.
I think that connects up. I think one of the messages that everyone's getting here is that, I think Sarah said it, they'll only do what we make them do. And if we don't make them do anything, then they're sending the message that our lives are expendable, right? We're going to have to fight for our lives.
Yeah. And so, I think you also, another good point is that there were all these other infection control protocols that they could have implemented aside from just the masking procedures that they haven't implemented. Right. It sounds like at your workplace and in my workplace as well, like we have only 7 days of sick time if we have symptoms of the virus. And so what that means is that nurses, doctors, whoever are coming back to work when they're probably still positive, infected with and spreading the virus. And so, if we're wearing masks around the patients, maybe the patients don't get infected necessarily, but we're at the same workstation with each other. And so the virus has the potential to spread in that setting. And so we had pushed for 14 days. They had even stronger protocols in China where you would have to have 2 consecutive negative tests before you could return to work. And I haven't seen that anywhere in the United States. Definitely not in healthcare. Some other infection control things, like we had asked for them to issue us the hospital scrubs so that we're not taking the scrubs that we wore at work home to our families and like potentially infecting our loved ones. And I think it gets back to like the guidelines were not written from the perspective of workers. They were written from the perspective of people that need to cover their asses. And so that's why it's not comprehensive. It only focuses on this particular work setting and not what we need right now.
Right. Let me say one more thing, and then I'm going to go to Eric, who's a transit worker in Chicago. I just wanted to maybe even tie it together at a higher level. I would go even a little stronger. And I think that, like, when you look at transit, and I think you can apply that to healthcare and to Amazon as well, what we saw early on was a refusal to acknowledge basic things that we knew from science and medicine had to be done to contain this and stop the spread, because they couldn't do it. And they made the decision, if we say that we have to do this and we don't do it, then we're liable. But if we don't say anything and we just let it go, then people will get sick, but we can try and cover over for it later. So everywhere you see the restrictions where, you know, they only started to say something was necessary when they could actually provide it, and it was already much too late, right? We see that with the CDC regulations as well. Everything is set up to keep essential workers working, even if they're not safe, because our work is important to them, our work is essential, but our lives are expendable, right? So why don't we turn it over to Eric? He's, as I said, he's a transit worker in Chicago. He can maybe connect up to some of the threads we're talking about with what's going on there.
Sir, can you hear me? Okay.
Yeah.
Inviting a transit worker from Chicago over to your call. We've been learning a lot from you guys in New York. I'm a shop steward for my coworkers, about 600 coworkers who are bus operators the last 6 years. I don't represent the union on this, to speak for myself. We do have a group called the Transit Workers Unite that has been solidarizing with you guys over in New York. And I think this crisis out of necessity has brought us closer. So a good thing. However, there's some really bad things going on. I know you guys have over 60, perhaps much more than that, transit workers who died in New York. You guys are a few weeks ahead of us, perhaps. We have our fourth transit workers have died in Chicago just the other day. So I think we should just stop for a moment and tell everyone who's on this call, if they're not a transit worker, or if they are and they don't know about that, this is really an emergency for us and an egregious situation that is cutting down our families. What is not being discussed enough is that it's not just the frontline transit workers, and you could say nurses, other frontline workers. It's also our family. It's that the people we come and get this disease. We might not have a pretty mild case. I got it myself. And then we bring it back to our families, our elders, in our community. And I really agree with what Seth just said about the covering up of the failure of the government, of the transit agencies, of management, not just in transit agencies, but all the frontline work locations, in saying that what is necessary is only what they're actually doing. And they're covering up their failure to take the proper policies in a full way, not a halfway measure, appropriately and timely. So in Chicago, just briefly, we're still having serious problems with PPE. Just after, similar to you guys, I understand, they originally told us we don't need PPE, we don't need a mask. They told us that it would make it worse. They told us, in fact, that if we did put it on, that would be a uniform violation, and that we'd get a safety violation for having it. And then they changed their tune, and then they said, okay, well, we're not going to write you up. And now they're giving us out a cloth mask, which is, they're telling us, they give us written instruction how to clean it, perhaps once a day, launder it. And now that might be helpful, but if everyone was wearing it who have it, but it certainly doesn't stop you from getting it. I understand you need not only an N95, you need the proper training. A lot of the nurses may have that, but we don't have it. We need professional to assist us, and that's not being done. the transit agencies are preparing to potentially shrink service significantly. At my garage, they put out a small temporary building, but that wasn't to put a healthcare worker out there to test us on property. That wasn't to give us information. That wasn't to assist us with the paperwork. I've heard from several people, well, I think both Chris and Sarah were talking about the bureaucracy. We face a lot of that as well. So we're not getting tested on site. They've just now, after demands of really a month, they're now pointing to us to go to an area hospital. But it's important to note that if the transit agencies or the workplace were to give this testing at the workplace and not have it off-site, then it's easier for them to say, well, you didn't get it at work. You got it at home, or you got it in your community. And we're not liable for death benefits. We're not liable for you to have injured on duty claims. We're not liable for you to have paid leave. And so I mean, I'm in a shop steward with coworkers for 3 terms now. And I know deeply, at least in Chicago, the transit agency management sees us as petty criminals. They see us as liars and thieves. And well, just the opposite is true, by the way. We're leaders of community, families, and we do amazing under very difficult conditions. Moving 1.6 million people a day in Chicago, which is nothing compared to New York, but it's a lot here in Chicago. We're the second largest behind you guys. Now, so they have this carceral, this like the prison system in Chicago, and that's they continue with that perspective during this crisis. They said, go back in there. You're just trying to get home for free and get paid, rather than do what's necessary. Those workers who are sick or have symptoms should be sent home. Those workers who have underlying conditions, who are older, should be sent home with pay. And they see that as a theft. And that has massively harmed the population in Chicago, especially the Black and brown population in Chicago, which is getting hit at twice the rate as other sections of the population. I heard Chris talking about surveillance. Man, that 1,000 cameras in that huge building, that's crazy. We also have 13 cameras in each of our buses that are directly connected to the Chicago Police Department as a live feed. It's a surveillance of the working class community, and it has nothing really to do with our safety. It has to do with liability of people who may hit the bus or be hit by the bus and stop people from being able to do claims, etc. So those are some of the things going on in Chicago. I really wanted to show some support to you guys, the Amazon workers, the nurses and other workers in the hospitals, and of course our brothers and sisters who are transit workers in New York.
Eric, could you briefly talk about a job action in Chicago related to unsafe working conditions, lack of PPE?
Well, reported by 308 for Justice, a caucus in our sister local. I'm the Amalgamated Transit Union and our sister local 308 for the rail. So we kind of separate things in Chicago between the bus workers and the rail workers for public transportation. And so what was reported is that a group, approximately 4 workers, were ordered to clean a rail train that had just had a operator who was having COVID-19. They were ordered by management to do so. They said, that's not safe. We don't have the proper equipment. We don't have the proper training and to deal with this hazard. You need to give us that training and equipment to do it properly. And the manager says, well, you either do it or go home. And so they said, this is not safe. This is against the contract. This is against the law. And they're going home. And that was a big step for us in Chicago because they fire people pretty quick for stuff like that, insubordination. Fortunately, those workers apparently were able to reach out. Well, first of all, there was a big discussion online in our internal Facebook groups, and workers were excited about what they did. And that in turn led to some of the union leaders in defense of those workers and management back down. So I think that's a good example of what workers are doing in transit and around the world, is taking things in their own hands, kind of like what the Detroit workers did. They acted first in mass, demanded things like PPE, demanded weird reporting, and we're able to get that through stopping the buses completely. And that may very well what we need to do as transit workers. Around North America, transit workers are talking about stopping the buses and trains to force the transit agency to take the necessary steps, because our buses and trains are still acting as a vector of the disease to the working class communities.
Anthony, would you like to speak? Steinecker?
Yeah, well, I'm happy to see that we're getting together like this. People from other cities and transit workers from other cities. Sarah, representing healthcare workers, and Chris with Amazon. And I guess something good can come out of this crisis, that we can build some more, some sort of a working coalition. And because see, that's what's lacking. That's what led to all of this, is because we don't have a real working class conscience here in the United States. And we've effectively allowed the bosses to turn us against one another. I mean, you look in the newspapers here in New York, and you know, we've gone from being overtime thieves a few months ago to now being heroes moving heroes. So, yeah. but you know, that's the theme, you know, nationwide. It's like whenever you see any group of workers, whether it's teachers who are demanding, you know, fair pay, that their students have ample supplies, whether it's nurses demanding fair hours or more pay or safer conditions, or us transit workers demanding, you know, that we get raises that keep up with inflation. The theme is to turn us against one another, and it worked. Now we don't have the proper equipment that we need to perform our duties safely in any one of our industries. You know, you read about Amazon and their efforts to unionize, and everything across in the media is demonizing these guys. We really don't have solidarity. It's like not many of us in other industries stand with one another. And what I want to see with us, just us here on this conference call, and anybody who's listening, is to, you know, start doing that. Like if there's if the EMTs demanding more pay, we all should show up and voice our concern about them, you know, the EMTs, because they're essential workers, they're frontline workers. You know, if I'm not working in transit, where else would I work? I'd probably be an EMT. My daughter might be a nurse, you know? So it's our class of people. We're the people who are out here right now dying. And prior to this, you know, we were all divided. And I'd like to see this to be the start of us coming together and exhibiting more of a class conscious, a worker conscious.
Yeah. Well, just picking up on what Anthony was saying, I thought it was great intervention. Solidarity needs to be concrete, right? We need to take concrete actions that show our unity. Part of that was us showing up at the nurses' rallies and numerous live. Yeah. And this is a big step forward. But I'd like to be even more concrete. I think that Sarah and us and the transit workers here and Chris, we can work together to get you the PPE that you need. Like, it shouldn't be workers stepping up to provide resources for PPE, but it's a matter of showing concrete solidarity. We want to start a GoFundMe for the nurses to actually start buying what you need. Like, I have no idea what you guys need. You know much better than we do what you need. But we cannot allow these asshole hospital bosses to get away with abandoning the people on the front lines like this. Just as we've put up our own money to provide PPE for transit workers, we want to do the same for you. So what I need Sarah to do is let us know how to help. You know, let us know where we send the money that's raised to. So Sarah, if you want to comment on that. I'm trying to.
Can you hear me?
Yeah, I can hear you.
Okay. Yeah, I mean, we're kind of in a discussion right now of next steps. as like healthcare workers. So I'm, it's not just me, thank God. It's a whole group of us that gives me so much life. So we're trying to figure that out, but that is an interesting idea that I can definitely take forward. I think one of the things that's become obvious out of this whole situation is that we, like, the actions and everything have been very inspiring, but we are like unequivocally like on the defensive. And so it would be interesting to think about what, if society was run by us, how would this have looked different? What would we have changed about dealing with a pandemic if control was given to the workers? And I think we would see something that would have reduced mortality, reduced infection, because what we're dealing with right now is kind of how do we prevent a bunch of people from dying, but also prevent the economy from collapsing. And the concern with the economy has kind of like taken over and been like counterposed to like how much death is okay for us to deal with, like at what economic cost, and what would it look like instead if we had a large enough social safety net that people didn't have to worry about their children starving, or their grandma dying. Like that, I think the question should be like, why are we in a society that functions this way? And like, what would we do differently if we had control?
Yeah.
I don't know if I articulated that well, but
No, that's
No, it was perfect.
And we always got to be thinking about, how do we stop this runaway train known as the capitalist economy where workers' lives don't matter? And we've been good at like symbolic actions, like this is shot across the bow was shook up the world, like just small action, but we do need to imagine a different world and try to make that possible. Talking about Chris struggle, like we need to know like next steps for how we can provide concrete support to you. I know that you called for like your Twitter page is called Shut Down Amazon. Could you tell us a little bit about that and how we can help you in your fight?
Yeah, absolutely. Just to piggyback off of what Sarah was saying, I have a couple of solutions, at least in my thought, will help out the community, help out the nation. The reason why I named my Twitter Shut Down Amazon, because Amazon is a breeding ground. That's exactly what it is. You just take my building alone, 5,000 employees in and out that building weekly, from all 5 boroughs of New York and New Jersey. I'm in New Jersey. I commute to work. It's 10 minutes away to Staten Island. Majority of the workforce live in New Jersey as well. Like Eric and Seth and Anthony was saying, like this virus spreads to 2.5 people. Sarah knows, this virus spreads to 2.5 people. 5,000 employees possibly could be carriers. 500,000 employees nationwide. Actually 600,000 now. They just hired 100,000 more, right? 600,000 nationwide. Almost 1 million employees worldwide. That's just Amazon alone. God forbid we all are carriers of COVID-19, and we're bringing this home to our families. You spread that to 2.5, you times that by 2.5, times that by another 2.5. You're talking about millions of people that's possibly can get infected from us frontliners going to work, just going to work. Now a solution with these billionaires, Jeff Bezos, and even the CEOs of the MTA or the transit, what they should have done was get with the government to really deem down what is essential and what is non-essential. They didn't do that. They left it so broad and vague that we're going to work, and then they're figuring out, well, hey, maybe we should have did this, we should have did that. They're doing Band-Aid work now. That's what I call it, Band-Aid work. One problem happens, you put a Band-Aid over it, to the next problem happens. That Band-Aid comes off the other one, but we're worrying about this one. What we should have did was, like I said earlier, my building is 900,000 square feet, 14 NFL football fields, but you got doctors and nurses working out of tents in New York. Doesn't make sense. There's your hospitals. Shut down Amazon buildings. There's a building in every major city, in every state across the nation. You shut them all down. Jeff Bezos got more than enough money to pay his entire workforce for a couple of months, and give these doctors and nurses, the real heroes, give them their hospitals. Why do we got them working out of tents? Why do we got to wait for the military base to send a ship? Why do we got to do that? We could have had hospitals. We still can have hospitals. We still have space for prisoners. We still got space for whoever we need to do to separate everybody. The nurses should be first. The doctors should be first. Like I said, these buildings are massive. They can hold millions of people. That's what we should have did. And then we'll be paid volunteers. Now I'm a paid volunteer. I don't have to go to Amazon every day. Send me over to support the grocery department. I have no problem going to a grocery store. That was my first job. I was bagging groceries, helping out senior citizens, load their groceries into their cars, so they don't have to sit home and order what one click buy and put people's lives at risk. Now we're volunteers. And now you got 500,000 of us nationwide that can volunteer, helping out the transit, volunteer, helping out the grocery department. We all quarantine. What else can we spend our money on besides food and traveling? So this is some things that we could have done differently. And that's the way I still see it to this day.
Yeah, Chris, just speaking with you, like it just strikes me that you have more like common sense next steps for what could have been done than are in the entire bureaucracy of the unions in this country has come up with in 40 years. And the action, even the small action that you led, showed more creativity and more courage than, pretty much anything the unions have done in decades. So, don't let anybody tell you that you're, that you don't have the experience. And everybody is very inspired by your. I'm going to call.
I appreciate that. Really do.
I'm going to call on Eric from Chicago now. There you go.
Yeah, I just want to complicate the unity question specifically to what's going on in Chicago. There's been some articles recently trying to pit passengers against public transit. I know a lot of people on this call are on the rail side. I'm on the bus side of it. One of the demands that the Detroit workers won when they did a wildcat strike one of the first weeks into this pandemic, was the rear door boarding. And we discussed this among transit workers, and several of the workers in our group said, no, don't do that. Because the only way they're going to do that is have a free ride. And I said, okay, let them have a free ride. That's good. We should have free transit or reduced fare. But then workers, these are, experienced bus operators. So wait a second, you don't want as many people on the bus. And so that was complicated. We took that out of some of our demands. Okay, well, some of the transit agencies are doing rear door boarding, including Chicago Transit Authority, and it feels almost as if they throw it back at us. How dare you demand that? We're going to use that against you. What's happening right now, I'm a shop steward for bus operators, is where the tension between the passengers, especially persons with disabilities, are not able to board through the rear, and persons with wheelchairs. And so they're whipping up the attacks against transit workers that we've seen for decades and trying to pit the passengers against the frontline workers. So that's going on as we speak right now. About one of the things that John was just talking about the union officialdom and the directions that they've been taking for generations, is that, they're really tied closely to the Democratic Party machine here in Chicago. And they have a great difficulty of breaking with them, even when it's the livelihood and lives of our coworkers. And what needed to happen was an independent perspective of the unions as a tool of workers to take action independently of the positions of the government, independently of the positions of the employer. And since we've been so long in this form of business unionism, hand in glove, backroom deals with politicians and top transit officials and business officials, that it was very difficult and still is difficult for the unions to mobilize quickly to do what's necessary for the members. So all this stuff is very important to be thinking about as we're trying to organize nationally and in our cities, from both workplace to workplace, between nurses and transit workers, between teachers and things like Amazon workers and other delivery workers, also who work for Amazon, that we should be thinking about perhaps taking some actions immediately. So I want to just put forward a discussion. I know that some nurses nationally are putting forward actions on International Workers' Day, which is a couple weeks from now, May 1st, which is an international day of action for the working class. Actually started in Chicago over 100 years ago, but very few people know about it in the United States. And it's a day for action for women's rights. It's a day for action for the working class to take power into their own hands. So one of the things that, real quickly, I'll finish on this, Chris was saying, I think Sarah was as well, is we can start to take control into our own hands. As Sarah was saying, that the rule book is not made by the workers, the frontline workers. And we can start, at least as transit workers, certainly we can start be working with passenger organizations, community organizations, working class organizations, to create the schedules, to make sure that we determine the proper protective steps that need to be taken now, and take it out of the hands of the transit officials, out of the hands of these people who've never been on our buses or trains, or never waited on the public, never were nurses or other workers, never delivered anything, never just sit on their butt right now as we speak. So that's what we need to be doing, and I hope we start taking immediate actions. I hope we start just talking about this International Day of Action on May 1st.
Okay.
I agree. Yeah, just piggybacking off of what Eric said, I'm glad you brought it up May 1st, because I actually plan on doing just that. Tonight around 8 p.m. Eastern time, I'm gonna be on the phone with about possibly about 50 to 75 different buildings from all over the globe about mobilizing an international walkout for Amazon. So I'm in the process of doing that, and I'm going to continue to do that. I'm going to mobilize an international walkout on May 1st. And I want the world to know that. It's no secret to what we're doing. As I keep stating, that we need to take the power back. And as long as we have people continue to go to work and be unsafe, and there's no response to preventing that, then we're going to continue to take action until something gets done. And that's what I'm going to do on May 1st.
Oh, by the way, Chris, just wanted to also talk about your call for boycott about Amazon. Could you talk a little bit about that? And then I wanted to go to Anthony.
Yeah, what did you say the first time you broke up?
No, I was saying you had been urging people to go a week without Amazon as a way to send the message before we get to the May 1st stuff. Do you want to talk about that?
Sure. Yeah, consumers, the way you can help us out, we need solidarity for consumers as well. Yeah, it's time to boycott Amazon altogether. What was we doing 15 years ago? We were going to the grocery stores. We kind of adapted, society adapted to the changes of times. And, these newer, generation babies, they want to call them, or millenniums. That's all we know. We know technology. We know how to get on a computer and order whatever you want. We have to adapt to our old society. Amazon is a fairly new company. It's only been around for about 25 years. It grew and evolved into what it is now because the consumers continue to spend their money there. Stop doing it. Stop clicking the one-click button. If you want to practice real social distancing, stop clicking the one-click buy. That's what I've been preaching because you may save lives. the process is easy to get a box delivered to your door, but at the same time, that package touches about 6 to 7 people that you're putting at risk, and you're putting yourselves at risk. This virus lives on cardboard for about 3 days. So you got to take all of that into consideration. So as a consumer, if you're listening, stop clicking the button, stop supporting Amazon, Whole Foods, until we are protected and we feel like they're doing something that's going to protect their workers. We all have to come together as well. And I hope that everybody's listening.
Yeah, I think, we not only need to practice social distancing, we need to practice social justice and solidarity with our fellow workers. And, so that would be a very big goal. I wanted to call on Anthony Steiniger now, who had his hand up. Hold on. You're on mute, Anthony.
All right. Yeah, John. I just wanted to reiterate on something that Sarah had mentioned, and I think it's really what everyone is facing, what every essential worker is facing. It's the choice between either feeding your family or potentially exposing grandma to a deadly virus. And I think that's what a lot of people are missing and what they really don't understand. It's that, we're being forced not to really be heroes, but we're forced into between a rock and a hard place. It's like a lot of people, we're union workers, so we have some protection. But people who don't have unions, like Chris, I'm sure that Amazon doesn't have a union. That's why they were able to get rid of you so unjustly and so swiftly. But a lot of your grocery workers, a lot of the essential workers who are riding our trains, they're forced between either losing a job or getting on that train and being exposed to a virus. That's not being talked about. And the only way we can stop this is if we actually stop, is we actually force the issue. See, we're being exposed. It can be done, but there's no will for it to be done by those who are in control. The billionaires really don't care. They want to open everything back up so that they can continue to make profits, so that they can still be in business. They really don't care how many lives that are lost. They're looking at this as a spreadsheet. Okay, we'll lose 50 workers from XYZ warehouse. We don't care. We'll hire 50 more people when this is over. That's the way they're looking at it. But we have to look at our lives as being, important to our families. We're really in a fight right now for our very lives and those of our loved ones.
Okay.
Absolutely.
Absolutely. I wanted to call on Seth Rosenberg. I can't believe Seth has been so silent all this time, man. It's not like to be so soft spoken. So Seth, you have the floor.
Yeah, we have. I mean, it's a testament. We have some really important guests here. Sarah, Chris, and Eric all have been playing leadership roles in their workplaces, and I want to let transit workers, I think transit workers have heard a lot from me, so I wanted to give everybody a chance to speak. And I'm going to ask a couple of questions that I'd like to hear answers from our guests, but also say a couple things, of course. The first thing I wanted to say is that I think it's really important for any transit workers, New York City transit workers watching this, if you can, get out and support Sarah and the nurses. They are, I think, leading the way. They've had a number of public protests. John was able to go out, and having a couple of us out there to show solidarity would mean a ton to them. And it will let the bosses know that we're starting to come together. And that if that starts to happen more and more, they're going to get scared, realizing that we could take joint action. So if any transit workers, on Local 100 Fightback, you're going to hear about stuff. We've been posting stuff about Sarah's protests. Traquan is another nurse leading protests. And also if Chris calls actions, and there are places where transit workers or other workers can get out there and be in public, socially distanced, and support them, right? We all have to support each other. Comes to a time we're all under attack with similar attacks. And if we can come together and support each other, then that's going to be a big step in fighting back. So one question that I want to pose to you guys that I'll get an answer from once I'm done is, if you can say stuff on any other specific things that transit workers can do, if you have any ideas to support you and your causes. I proposed getting out there to specific protests. Any other ideas would be helpful. Eric mentioned May 1st, right? May 1st, if people don't know, is actual Labor Day. It's the first Labor Day. It's International Workers' Day, and it's been a day of women's rights, of immigrants' rights, and of workers' rights. And it's coming up now, and Trump wants to reopen the economy in a lot of places on May 1st, even though the science and medicine do not back that up. And so we need to take a stand both in a fight for our lives and for the tens or hundreds of thousands of lives around this nation that would be put at risk. So the idea of coming up with joint actions where we can all do stuff on May 1st, whatever we can do in our workplace to work together, I think is key. I also want to pick up on something Sarah said earlier and take it in a different direction. Right now, we're in a defensive fight, right? We're in a fight for our lives because we're not getting the safety equipment we need. But we have to start thinking about the steps after that, because once peak is over, there's going to be a number of fights coming up that if we don't get organized, that we're going to let the capitalists, the bosses, and the politicians and the billionaires, we're going to let them take charge in a number of ways. I don't know if people saw, but in the New York Daily News, they already called for a public worker wage freeze, right? During a pandemic where we're going to be in a recession, we've got a number of those people are essential workers, and they're asking people in a time where there's a financial crisis to not be able to, get the raises we need to keep feeding our families. And so that's an issue we're going to have to fight. We know that, Trump is calling for fights for cuts to farm workers' pay, right? Talk about essential workers who are in the supply chain to keep us all fed, right? His solution to farm problems is to pay farm workers less, right? This is another thing that we have to fight. And as I mentioned, right, given that we're all people fighting for social justice, we believe in the working class, believe in solidarity, this idea of putting profits before people to reopen the economy before it's safe, without adequate testing to track the cases, right? Without a vaccine, you need something in there. We know, the scientists know what's necessary to stop another wave from coming out, and we don't have it yet. And we've seen Trump and his supporters calling for reopening the economy regardless. And if, 10,000 or 100,000 extra people die, well, that's the price we have to pay. So we need to think about steps, if we can get going on defending ourselves, on the wider steps to not just defend ourselves, but to defend the country and the working class as a whole. So I'll end it there, but I would like people to answer that question with respect to next steps that people think that transit workers can take to support them. And also, it's kind of come up in sideways, but I'd like to hear specifically, from Eric and from Sarah. I'm not sure how much Chris could say on this, given his workforce isn't unionized, but what and then maybe from Jay or John or Anthony with respect to our union's responses, or lack of responses, because I think it's a pattern and very disturbing. But we need to talk about some of the fact that we haven't been defended by the organizations that are supposed to defend us. So.
All right, so I'm going to call on Sarah, who has her hand up. Let me just, you're unmuted yourself, did you?
Yeah, I did. I have that power.
Sarah.
Yeah, I mean, first of all, if y'all have any actions planned, Chris, if you have any actions planned, transit, any actions planned, I am totally there, and will invite everyone that I can. I think
Appreciate it.
Yeah, it's already been said, but solidarity is more critical now than ever. As far as what transit can do, I mean, like I said already, we're still kind of trying to figure out our next steps as far as healthcare worker organizing. But I think one of the things that surprised me is that, transit workers have a tremendous amount of power, and y'all literally have the power to shut this city down. And, the ability to exercise that would be powerful, not just for your own demands, but for demands in solidarity. I know that that's a huge organizing challenge, you know, and like, you know, like difficult to prepare for, but the ability to say like, we will not work until X, Y, and Z demands are met, they should be afraid of you. They are afraid of you. And you know, if you know, I'll just stop there. Y'all have a lot of power. And then, you know, the last little piece, I think, Seth, you were kind of talking about how like we know that austerity is coming, basically. And we have to, unfortunately, even though, you know, I think it's useful to think about what, you know, our dream scenario of what it would look like if workers were running society. We do have to start to prepare for combating austerity. And I think it's been especially obvious for me seeing like Cuomo in these briefings kind of like scratching his head about how is it that COVID is, you know, we have to do more research about how COVID is killing more, you know, Black and brown people. How could that be? Meanwhile, we're going to cut funding to the New York City public healthcare system, you know, and cut Medicaid and further like, you know, whittle away these resources that marginalized communities rely on. And, you know, I think like a cross union movement around those issues is like an ideal. And, you know, I think, yeah, I'm gonna stop there.
Okay, Sarah, thank you. I wanted to give Chris a chance to speak because he was asked a question by Seth.
Yeah, sure. So first and foremost, I know I'm not a part of the union. I was previously, before Amazon, I did work for a union for about 3 years. Pros and cons. You know, I do respect the fact that the union does protect workers' job security. That's one thing that they all preach. What I didn't like was, you know, just certain things, but as far as the wages are, the way the wages were increased over a time of period. The 10-year contract I had with the union that I was previously in, the wording could have been a little bit, the dialogue and the conversation between the shops or the higher ups that made the contracts could have been better. But obviously I wasn't there for that. So I want to say, John, you kind of touched on this, and Sep as well. And Sarah, this is the time. Well, we all did. We all touched on this. This is the time for us to basically rewrite the rule book. And that means the rule book as far as the guidelines, the rule book as far as employee rights, social justice, and the rule book as far as unions. Mm-hmm. The one thing about unions that I've noticed just from my short period of time, because I wasn't an organizer before March 30th. I'm still not an organizer, but I'm doing organizing work. I've learned that it's a lot of divisiveness between the unions. It is what it is. You know, everybody, a lot of unions have reached out to me from all over the world within the last 2 weeks. And they all have, I noticed that, yeah, they want to be in solidarity, but they all have their own individual motives. And that is the number one issue. The billionaires and the CEOs, the reason why these companies like Amazon are not unionized is because they realize that they can divide and conquer us in the blink of an eye. The problems that we have in New York community, and we're not going to have that in LA and California. And then they know that. They are well aware of that. They know they could fire me in New York and fire two in Seattle and know that eventually this is just going to be another story that's swept under the rug. Yep. But not this time around. They fired the wrong person this time. Me, I have nothing but time on my hands now. So they did me a favor. And what I'm going to do is utilize this platform that I have. The fact that my face is in every international newspaper right now as we speak. Right. And the fact that I have the media pretty much at my fingertips, I could text and call CNN or whatever major news network right now and give them a story. I'm going to use that to the advantage everybody. Never was about myself. It's not about one union, even though one union there's a couple that supported me from day one. It's not about them either. It's about everybody in the entire nation. So like Sarah and everybody else is saying, we all need to come together right now in solidarity and actually be a part of what we're doing, whether it's protesting, walkouts, showing up for each other, whatever we got to do to show that we're all together now. And me utilizing this platform that I have, as far as the media, I want to show up for you guys. I'm going to do the same thing with transit. I'm going to do the same thing for Sarah if she needs me. And then we'll figure out the organizing later as far as what the nurses need. But as far as right now, we got to take action by showing that we're all together this time. And once these CEOs see that, they have no other option but to address the real issues. And I think that what we're doing right now today is a perfect example of how we get started. We spread the word, we talk to our coworkers, and we continue to be consistent. Even after May 1st, we got to be consistent on continue to keep the communication and the dialogue going. We got to stay the course. And May 1st, yes. What I'm asking for with everybody that's even listening and everybody on the call, no matter what field you in, no matter what industry you work for, on May 1st, you don't go to work. That's how we take the power back. We all stay home. The nurses, the doctors, not so much of them, but the nurses and doctors, they will get the support they need by us, the frontliners, supporting the fact that they need the proper PPE. I'd rather go take a day off from work and go bring them a box to the local hospitals. Something that John wants to do. So that's how we help them out as well. And those who have the day off, just on the regular schedule, stand out there in solidarity with us. And that's how we should take action.
Okay, I'm going to call on Eric from Chicago. I'm sorry.
Yeah, Chris, I'm totally with you about they messed with the wrong person. This inspired me a couple years ago because I was a shop steward for 10 months, and we went on an international campaign, and we won my job back and my position back as an executive board member. But every day I said, I'm going to make more hell for them than if I was driving the bus. I'm going to that calculation, make them make that calculation that it's better for them to have me back to work than have me a full-time activist. Okay, so about something Sarah was saying about the power of transit workers, she's right. To a degree, the super wealthy who run the show, they don't really care about the public hospitals. They have their own private hospitals. They don't care about public transportation. They got their own private ways of doing that. They don't care about the public schools. Their kids, if they care about their kids, go to private schools, right? So they do care about workers getting to work. They do care about strikes, especially something like Amazon or major industrial centers. They do care about the consciousness of working people. Because we start becoming conscious that we don't need them anymore and we can run things ourselves, that becomes a big problem for them, a social problem. Not just the social distancing, but a social crisis. So I don't know, it's only a couple of days until May 1st, but one of the things that we have been throwing around is this demand, no PPE, no testing, no work. And I think we should look at the recent tradition in the United States. Of course, it goes back over 100 years, but recently, just in 2006, there was a general strike called by immigrant workers in the United States. It was called a Day Without an Immigrant. And it was a political general strike on International Workers' Day. And I remember it was the first day I was supposed to drive a bus, but they couldn't get anybody to teach me because they had to have all the instructors driving the buses because it was $400,000 workers in the streets of Chicago on May 1st. So, I think we got to get moving quickly if we're going to do that. We got to get quickly. Certainly it's being discussed. Many transit workers are discussing we should shut it down. We should have a thorough cleaning of the transit systems for the safety of the public. I really like the political line we're discussing here as to say, okay, this is a strike for the medical workers. This is a strike for the frontline workers to get PPE, to get testing at the work site. And without that, we cannot safely run the economy. And so we need to make it clear that the economy doesn't run without us. And the way to do that is to put down our tools, to not drive the buses and trains, et cetera. So again, that's going to take a lot of organization and acting quickly. But I think the call or the discussion can be put out immediately. No PPE, no testing, no work on May 1st.
Yeah.
Agreed.
Yeah, obviously agreed. I just wanted to follow up on Seth's question about the bureaucracy. I think we know we don't need the bosses; they need us. But we also have to be honest about the fact that I was appreciative of Chris's intervention regarding his interactions with various unions and the bureaucracy and how they think, and how they want to do it. They want to do only what's in their narrow interest, and they have their own agendas. The problem in our case is that we have a bureaucracy that is literally an appendage of a scumbag racist governor named Andrew Cuomo, who basically lives to serve their master. They live to be his public relations rep. They're scared and terrified of our members. They haven't had so much as an online meeting, anything like what we're doing right now. Union leaders could do that. You could organize that. You could have an encrypted web chat for people, and only union members could be involved. But they won't do it because they're terrified of us. And what they're terrified of is that if workers become angry enough and workers become conscious enough, they begin to see that they don't need their bureaucrats either, that they are temporary, that we are the power of the union, and that if we organize ourselves, we can throw them from the train. And that's what they're terrified of. They're terrified of that. When that happens, when we realize that the tremendous power that we have, that their days are numbered and that it's over for them. And so that's why the way in which we modeled ourselves as an organization, Local 100 Fightback, is about being a way to amplify working class voices so that we know that we're not alone, so that we connect the various struggles that are going on. And the mindset and the mentality of the ruling class is the same everywhere you go. I mean, they may not all be Trump, they may not all be full-throated racists, but the contempt that they have for working class and oppressed people is the same everywhere. And that's what's inspiring right now, is that people are beginning to see that. But we also have to be aware that it's a very dangerous period too. You have social disorder going on, and you have the right wing rising, and you've seen the protests in Michigan and Minnesota. If we don't solve these problems, if we don't find our voice, if we don't rip power from these bureaucrats who are betraying us, we can have a civil war in this country. It's like things are very sharply posed. And, so these are an important step forward, but we need to be talking not just to people on the call, but the people who are watching the call about how we can defend ourselves, and how we can build organizations that can actually lead those kind of struggles. Seth has his hand up again. There you go, Seth.
Yeah, just quick. I'm monitoring Facebook as we're talking. I don't know if people saw this. Maybe it came out right now. Maybe it came out earlier. But there's an article in the New York Post. Not a fan of the Post in general, but an article in the Post basically looks like 4 New York City council members have written a letter to Cuomo saying that he needs to shut the subway down to stop the spread of COVID-19. And, that's a good step. We've been saying that for quite a while. So I'll put that up as a link there, but it's, relevant to what we're talking about. Also, sad to see that New York City council members are ahead of our own union officers, right? Like we got probably, I think, more than 70 New York City transit workers dead, right? Thousands infected, and our union has not called for the system to be shut down. I think it's a complete abdication of their responsibility. But at least the idea is getting out there now that to protect transit workers and New York City as public in general, that the vector of the subway system needs to be shut down. There are ways to get essential workers to and from work if we mobilize all aspects of society, if we use hotel rooms nearby hospitals, if we, their tourists aren't renting cars. Why not give a free rental car to everyone, every essential worker? They can, parking spots are available. No one's going to work. You could give everyone I'm just speaking off the cuff. I don't know if this is a coherent plan, but it's just one idea off the top, right? So everyone's socially distanced. They're all in a free car, right? And they can get to and from work. You don't have to have the petri dish of the transit system. I don't know what other people think of that idea, but that's just one thing that could be done. We could shut down the system and get people to and from work, right? It just takes a thought and mobilization and actual caring about people's lives, right? So I'll post that article up so people can take a look.
Okay, great, Seth. Eric, Eric Slater, you have your hand up here?
Yeah, I just have some sad news real quick. Another Eric in our group called instead of me, but he's gotten sick. He just tested positive for COVID-19. So I hope everyone has him and his family in their thoughts. Excuse me.
It's horrible.
I didn't get to answer one of Seth's questions. I just bring it up about the union. So I'm a member of the Amalgamated Transit Union, and you guys, I think, are over at Transit Workers Union in New York, Local 100. Now, our international unions just put out a joint statement. I think it was the second statement they put out. The first one wasn't that bad. At least it says we may have to take action or something like that. The second one was really frustrating because it was a pleading with the politicians. It was a pleading with Cuomo, right? But Cuomo really has a lot of blood on his hand at this point, even though the capitalist press is talking about how great he is, a great leader he is. But what we're seeing on the front lines is a very different story. And in pleading with them, saying, please give us the proper equipment, proper PPE, please give us testing. And that's not, so I'd like to propose that we did put a response. Our caucuses, the Transit Workers Unite, as well as Fightback 100 in New York, responded and said, no, we should be making demands. We should be organizing our union power. And to speak about that, what Chris was talking about and Sarah, we do have power. Only 1 in 10 workers in the United States have a union. It's a privilege in many ways to have a union, but it's also a responsibility, because a union is a tool to take concerted collective action for the entire working class. That's what it's always been historically, or it has been in its stronger periods. And so, you have meetings of workers, you can collect resources, you can and take concerted actions such as job actions. And we also have international unions, which is a very positive thing as well. We're connected city to city. And in my Amalgamated Transit Union, we have 200,000 families in North America, Canada, and the United States. It's a huge, powerful force, one of the largest and most powerful organizations on earth. And we're begging just for our lives, and that's wrong. So I hope that we put out another response. I know Seth was discussing putting one together. Perhaps we can call for action. Perhaps the response could be for participate in the International Day of Action on May Day. So I'd like to just leave it at that.
Okay.
Back to Cookie.
Yeah. Good. Oh, he did mute himself. Okay. I think that that we definitely need to be putting out as many demands as possible. And I think that the idea that the city council is now calling for the subways to be closed could be a way to pivot towards making demands on the union leadership and really turning up the heat on them. I would like to thank everybody for being here. I know you guys, dedicated a lot of your time and resources, and it just shows how important these issues are. And, I hope this is far from the last time when we get together and discuss these issues and also be joined in actions together. Chris, if you can please let us know any of the upcoming actions with specifics about May Day, please let us know. We encourage everybody to get in touch with Chris. We know Chris's Twitter feed is very busy, but I'm sure he wants to hear from you, and any way we can connect, that'd be great to do.
Absolutely.
Also, Sarah, please let us know. We'll talk privately about how to best raise funds for the resources that you all need. And any upcoming demos, please let us know. And you guys are always you guys have to know you're always welcome anytime. We have this platform, just like Chris says, he doesn't do this for himself. We don't do this for ourselves. This is not about elections. It's not about popularity contests. It's not about building our brand. It's about the real life and death struggle to save working class lives. So
absolutely,
everybody.
Yeah. And I just wanted to say, it's a very dark time. We've talked about a lot of stuff, the spread of the virus. We haven't got what we needed, lack of protection from the unions. But like when I see this array of faces here, different people from different sectors standing together as a possible nucleus to build a fight back, it warms my heart. That's, for me, I've been a union person for a long time, and like the idea of solidarity and building joint action is natural to me, and it's something that when I see it like this as a potential to move forward, it just gives me hope, and I really appreciate you guys.
Yeah,
absolutely.
I also wanted to let Jay, make some last comments. Unfortunately, I'm worried that you got lost in the shuffle here, Jay. Can you unmute? I'm having a problem unmuting him.
He's got to do it.
Jay Holland, can you hear us?
Yeah. Well, there was so much, good stuff that was being said by all. I mean, I was just mostly an active listener, which I don't mind doing at all. And I see and trust that everyone's definitely have what I consider the right things to say. So if I don't even think I really you all have, for the most part, touched on everything that I would have even thought I or anyone who's following this needs to hear. If I might just add, to touch on initially what I asked Chris about earlier, and referencing that interview with the Hill and Rising, even I would say along with other political action type things that we can do is let's watch the media that we follow. A lot of the mainstream media and, a lot of the people that run in the circles that I run in, and family, et cetera, extended friends, we're all used to kind of being really down on the Republicans and their Fox News. MSNBC is just as bad. They are just as bad. That's not even the left version of Fox News, because that's the corporate left. MSNBC is not to the left as what Fox News is to the right. They're to the corporate left, as in the establishment for the Democratic Party, as to what Fox News is to the Republicans, right? So let's make sure, you can't force anyone to watch any certain thing, even your family members, but talk to them about that. Make sure people in your family know about certain media. Think about it for a moment. Chris was interviewed by a popular news channel on YouTube, right? You think he would have gotten that interview from Rachel Maddow on MSNBC? It definitely would not have gone down like that, right? So think about the media watch the media we follow. Give subscriptions, give popularity to the proper channels and independent media, right? That's definitely one thing that we can all do. We can also share it on Facebook, share it on I was going to say Instagram. Yeah, do that too. Share it on Facebook, share it on Twitter, link to these people, because these are the people that are really going to help us in the right directions. Because stuff that mainstream media is not going to do it. CNN's not going to do it. Fox News definitely ain't going to do it. MSNBC definitely ain't going to do it. A lot of the local stations that took all that money from Bloomberg, not going to do it, right? The independent media that mostly is progressive, but it doesn't even have to be necessarily political, just the independent media that's not beholden to corporate and a lot of, money. Those are the ones that are going to, definitely play a big part in doing the right things.
Yeah.
So I know I rambled for a moment, but I think that was important.
It's all right. It's like a crew room, Jay. It's all right.
An informative crew, right? I don't think
I'm about to say,
anyone here, no one here was kind of a cool lawyer.
You've ever been in. Chris,
just to piggyback over Jay. It's too late for me. I'd have been on MSNBC twice. I'd have been.
Chris,
I done been on there twice. I done been on CNN. I done been on Fox. So I said what I had to say on there. Trust me. I know they tried to box me in. So just to let you know, they didn't get me. I spoke my truth, and I hope they understand where I was coming from. That it don't matter what type of way they try to spin the questions.
Yeah.
I was telling them the truth, and I still am. I tell that to everybody. So.
Well, I mean, yeah. None of us give you problems going on where you can get more audience. That's absolutely right. But I think Jay's point is valid that
absolutely
independent media really opened the door for you to be able to do that, and you should use it to your full advantage. But but bottom line, like the working class needs its own media. We need our own ability to network and talk to each other and have our own voices heard and not filtered by anybody and be asking the questions ourselves. And this is just a small taste of what that could look like. So thank you guys for making that happen.
Absolutely.
You all have a great night. Okay. We'll be in touch real soon. Okay. Anybody want any last words here before we go?
Take care, everybody.
Take care.
Thank you.
Everybody stay safe.
Be safe.
Stay safe.
Thank you. And thank you all for watching. Thank you.